11:42, welcome back. May marking American Stroke Month. Strokes can happen to anyone at any age. Having a stroke puts you at a higher risk also for having a second one. And most adults in the U.S. don't even know the stroke warning signs, but it can be very treatable if you recognize those symptoms early. And that is why we have Dr. Ted Harris with HC Virginia here with us on the Midday Show to break down what we need to know about this very important month and this very important issue. Thank you for being here. So talk to me. Why is it so important to raise awareness of stroke warning signs right now?
So it's mostly about letting people know that stroke is a very treatable and preventable problem. And we found that stroke is the 5th leading cause of death in the United States and actually the 3rd cause of disability. So any given year, almost 800,000 people will have a stroke or stroke-like symptoms. So helping people recognize that a stroke can affect anybody. It's not just the elderly, it can be younger. There are certain populations with certain diseases that have a higher risk, and by helping people recognize ways they can prevent this from happening in their life or recognize those signs is the goal.
And so talk to me, what are those signs? I mean, what should I be looking out for if somebody is experiencing a stroke?
So about 15 years ago, the American Stroke Association came up with a very simple acronym using the word FAST. And so if you take the letter F, that stands for face. And so if there is a drooping of the face or weakness on one side, that's going to cue you in that somebody, either yourself or someone you know, is suffering a stroke symptom. The second letter is for arm, and that could be arm weakness. And the third letter is S for speech. And so if you're struggling to find the words you want to say or everything comes out jumbled, that can be a very clear symptom of a stroke. The last letter is time. That's just to highlight the importance of calling 911 immediately and getting yourself or your loved one to the hospital so they can get treatment.
I mean, seconds, minutes matter in that kind of situation.
Absolutely.
There. So why is it important, though, to respond quickly? I mean, we're talking about, this timely manner of it. I mean, if you don't act really fast, I mean, it could have long-lasting impacts for that stroke victim, or they can even die. Right.
And so that really is the key factor. We have a saying in neurology that, time is brain. And so if you get to the hospital quickly, you significantly increase your chance of having a survivable stroke or even reducing the disability to the point maybe you don't even have those symptoms in a few weeks or a few months from that time frame. So getting into the hospital is crucial.
What is important to know about stroke prevention, I guess, would be another good question.
Well, because it is a preventable disease, and we estimate somewhere between 80% to 85% that strokes can be preventable. So knowing what your own risk factors are, and that you may not know what those are immediately, but working with your healthcare provider to identify what disease processes. So if you have diabetes, addressing that, or if you have high blood pressure, that's one of the most common reasons people have a stroke. So keeping your blood pressure normal, that's going to significantly reduce your risk of stroke. And then just lifestyle things, whether it's being more active, changing your nutrition, working on some weight loss, things like that can significantly help minimize your risk of having a stroke in the future.
Oh, wow. All right. Well, Dr. Ted Harris, thank you so much for being with us. May marking American Stroke Month, and again, very important to know all these signs and factors. And I guess my question for you, too, before we go real quick, if I want more information, should I be talking to my primary care physician, or should I be reaching out to a doctor like you?
Well, I think I would go first through your primary care, and depending on what your issues may be, then you may need to come see a neurologist to kind of address some nuances of your issues. And there are other resources online. Stroke.org is put together by the American Heart Association and Stroke Association, and a lot of great information there as well.
All right. Thank you, sir. Appreciate it tremendously.
Thank you.
Time now for weather.